in both of these cases, traditional sort of ketamine treatment for depression, the induction series through a series of IV infusions at a ketamine clinic over here, and over here using ketamine as a psychedelic for psychedelic assisted psychotherapy, which is a very different model. Both of those are using ketamine, but they don't have much else in common. Over here, ketamine is being used as an antidepressant. It has been dosed as a medicine that relieves symptoms. There's no intention in this model of dosing ketamine at a psychedelic dose or giving someone a psychedelic experience. In fact, you try to minimize that, and that's intentionally try to avoid that, because the person is really coming in trying to get the medicinal, pharmaceutical effects of ketamine, because it has those antidepressant or anti-anxiety or pain-fighting properties. When ketamine is used as a psychedelic, it is dosed intentionally at a psychedelic dose. This is a little bit of a different strategy than in a ketamine clinic. How you get the medicine into a person's bloodstream can vary, and there's several different methods of doing that. I'm going to talk about that next. But you want to get them at a blood level that produces a psychedelic experience. And then you're using that psychedelic experience to enhance their work in psychotherapy. So this is a psychotherapy intervention where we're trying to use the altered state induced by a psychedelic to enhance or fast forward or accelerate the work that they're doing in psychotherapy. And therefore you're taking the medicine with your therapist in the context of a lot of preparation work around using the content of the experience as part of your psychotherapy treatment. So in traditional ketamine clinics where you come in to get treated for your depression, that is not the case. It is not treated as a psychotherapeutic experience. There's no therapist present, and it's not treated, frankly, as a psychedelic at all. You are getting an infusion of a medicine with hopes that your mood will lift or your symptoms will improve. Over here, we're not actually focusing on your mood lifting, because you may do a psychedelic session once and then wait weeks or even months before doing another one. You're not doing this rapid 2 a week for 3 weeks. You're using it occasionally, the frequency really dependent on what you and your therapist decide. And you're using it intentionally at a psychedelic dose. And the point of the experience is to use what comes up for you in the psychedelic experience to help you therapeutically. It is not to repeat the dose multiple times to reach a certain antidepressant point as a medicine. So understandably, that can be confusing. And it's really important to try to disentangle those models and those paradigms, both for yourself and when you're talking to clients, because it is very, the intention is quite different.